It's Brad Beer, POGO's founder and also senior physio. Today I'd like to talk to you about the chief causes of lower back pain. Lower back pain is an enormous burden for society, and certainly even a more enormous burden for the back pain sufferer. Statistics are as high as 60 to 70% of Australians experiencing lower back pain in any given year. The causes of lower back pain are many and varied. However, throughout my many years of clinical practice, I've come to understand and observe that there are several key contributing factors. These contributing factors tend to exist no matter what the condition or pathology that the lower back pain sufferer is experiencing. Let's take a look at these common causes of lower back pain. I'm going to start at the bottom. Lower back pain's here in the middle, and what you can already see is that there are several arrows or several circles feeding in to create lower back pain. Just to clarify, this is exempling the fact that there's not just one factor contributing or causing someone's lower back pain, but there's a combination of factors. In practice, when I explain this to my patients, my lower back pain sufferers, I often use the analogy that it's a little bit like baking a cake. You need just the right amount of the ingredients to mix together to get an outcome. In terms of this analogy, we're talking about lower back pain. And if we mix enough of each of these together, you will experience lower back pain. So let's find out what these ingredients are. The first key ingredient for lower back pain is a stiff thoracic spine. The thoracic spine is the part of the back that sits above the lower or lumbar spine. The thoracic spine gets incredibly stiff in just day-to-day activities. In fact, there's very few people walking the earth that aren't stiff between their shoulder blades. The problem with this is that stiffness through here will put excessive load or strain on the lower back. In addition to stiffness in the spine, there's also the problem of tight muscles. Tight muscles predominantly refer to tight muscles around the pelvis. Technically, I refer to this as lumbopelvic muscles or lumbopelvic musculature. And the muscles of key contribution to the lower back pain are tightness in the glutes, tightness in the hamstrings, tightness in the quads, and tightness in the hip flexors. Each of these muscles, if they're tight, will disadvantage the lower back by putting more strain and more load on it and making it more susceptible to create pain. The third key factor on top of the thoracic spine stiffness, the tight muscles, is body weight. This is often a delicate subject and one that many people don't easily digest. So in practice, I tend to be very diplomatic when I approach or when I discuss back pain sufferers' body weight with them. The irony is, and the message that I hear time and time again, is that because people are in pain, experiencing lower back pain, they don't feel that they can do the activities that they normally would, and as a result, they end up with an increase in body weight and, as a result, escalated lower back pain. It's a vicious cycle. However, the realities of lower back pain is that if you are 5 kilos, 10 kilos, or even possibly 30 or 40 kilos over your ideal, or what I call your ideal frame weight, ideal body weight, then that extra weight is sitting on your lower back irrespective of what activity you do. The reality of that is that the load through your lower back is exponentially larger. This greater load will put more pressure on all the structures that line the lower back, and it will be one of your key contributing factors or causes of your lower back pain. Going down the body, we also need to address low back pain sufferers' foot type and their foot position. In simple terms, one of the chief causes of lower back pain is an overpronated foot. An overpronated foot is synonymous with a dropped arch foot. Such a foot will tend to internally rotate the hips and thighs inwards and drop the pelvis in a downwardly positioned inclination. This will load up the lower back, increasing those loads and increasing the pain. So, in summary, if you're a lower back pain sufferer, there is never just one cause of your lower back pain. There will be several drivers that, if you're serious about getting the right outcome that isn't just a quick fix, but rather a comprehensive and tailored, successful return from lower back pain, then you really need a therapist that will help you identify the chief contributing factors or causes of your lower back pain. Back pain does not have to be a death sentence. So, see your local physiotherapist. If you're a Gold Coast resident, we'd love to see you at POGO Physio. Back pain is something that we have great success with in helping people overcome it and getting them back to doing the things that they love to do so they can have daily fun, whether that's picking up the kids, running in a park, playing a game of soccer, tennis, round of golf, having a surf, or going for a run. We'd love to help you, and all the very best. I hope this has been of some benefit.